I'm Dr. Michael Latola.
And I'm Megan Strong.
In today's Case of the Week, we take a closer look at the power of the study model in CAD/CAM design.
And I'd be lying if I told you the first story we have for you isn't terrifying.
And stay classy, American parents. Your kids are supposed to post online videos that embarrass you, not the other way around. That and more on today's Chairside Live. Hey now, hello and welcome to episode 127 of Chairside Live. 127, do you remember that movie, 127 Hours?
Yes, I would prefer not to remember it though because it was quite gruesome.
Well, in that case, let me remind you what happens.
Thanks, appreciate it.
James Franco's hiking, falls into a crevasse, and ends up with his arm trapped behind a rock and stuck, and literally has to, the whole ordeal takes 127 hours, literally has to cut it off with like a dull knife to be able to escape, and the guy went on and had a great speaking career, motivational speaker now. It's pretty amazing. You think you could do that?
I was just about to ask you if you would do it. I think right now I would say no, but in the given situation, if that was my only chance for survival, yes, I would.
Earlier today, I sat down as we were getting started to do this, and it wasn't my elbow, but it was part of my coat got actually caught in the hinge of the chair, and I started screaming, and I was in tears. So it wasn't even a body part. I thought I might just have to cut a little piece of the jacket off.
So what you're saying is you would have died in that canyon, in that crevasse, I'm sorry.
Well, yeah, but the good part is I was such a wimp, I wouldn't have been there in the first place.
Okay.
So
good.
Pretty safe because of that,
nice.
That little bit of cowardice on my part. Well, we do have a good episode for you today, and the Case of the Week is an interesting look at a doctor who sent in preps for crowns on 7, 8, 9, and 10 for our newest product, Anterior BruxZir. And it's not so much about the Anterior BruxZir in this case, it's more about the study model that he sends along and how we're able to utilize CAD/CAM to give him and the patient exactly what they want. In fact, let's take a look at that now. In this week's Case of the Week, again, we find a dentist doing a lot of things correctly, a dentist who prescribed Anterior BruxZir, but I want to give you a closer look at what we're able to do today with CAD/CAM. So this is for crowns on teeth number 7 through 10. So we have a full arch impression here in a plastic stock tray that looks nice, and when we pour it up, we end up with this model. And we can see a lot of what we need to see here, very nice preps. As well. As we look at the articulated model, that's BruxZir Anterior, by the way, that sticker that's on there. Clearance looks like, is there enough room here? Make sure those dies are seated all the way. And these are 4 crowns that were made here as well, and they want to match that, match the same shade as those. So we'll see when we scan this if there is in fact enough room there. Might be tight for EMAX, probably going to be okay for BruxZir Anterior. And a couple other things that that this dentist sent in. One was a pre-op photograph of what the patient looked like. They have 2 crowns here that they're not real fond of, so they're going to redo these 4 crowns here and make them lighter, go with that higher value shade you see on the lower. And the dentist also sent us a picture of the preparations too, which is nice because for something like an all ceramic crown on the anterior, probably more so with EMAX than BruxZir, we like to know the stump shade and what we're dealing with underneath it. In fact, we like to know that for no prep veneers as well. And we're not sure how to ask for it because there's no stump with a no prep veneer. So let's say we were going to do veneers on these 2 teeth. Let's say we're going to do EMAX no prep veneers. We really need to know the shade of the tooth in this state so that we know whether or not we need to do any opaquing on the veneer. For example, if you wanted to do no prep veneers on these 2 teeth and take them from this shade, this whatever C3 might be, to B1, for example, it's not going to work with no prep unless they were zirconia veneers. And even then, we'd probably want some reduction for other reasons. So we do like seeing photographs of the teeth, especially with a shade tab in place. But here we can see that, because it is for Anterior BruxZir, none of these preps are going to show through. So that's not an issue. Even though Anterior BruxZir is more translucent than regular BruxZir, as long as there's adequate reduction, it won't show through. If it gets really thin, there's a possibility it might show through. So also in addition to this, and this is probably the most important part, the dentist sent us a study model of what these teeth look like. Added a little wax there on that central incisor, wanted to build that out a little bit and kind of show it to the patient, and didn't want us to follow this exactly. Wanted us to make like the centrals not quite as bulky and add a little length to those as well. But we're certainly able to follow a study model exactly too, if you want us to. And this is part of the promise of CAD/CAM that we really haven't been able to do before. And so when we get this, we scan all the stone models, the prep model and this model, and then we take it into the digital environment. So the first thing we're going to look at here is going to be a scan of the study model. And you can see this is that study model here. This is the scan of what that looks like. And below it, we have superimposed it onto this scan, which is the scan of the preparations themselves. So this black line represents the study model that the dentist took the impression of and sent to us. And this represents the prep that's on the tooth. So you can see we do, in fact, have adequate reduction. I didn't print the screenshot, but when you click the two dots here, we have a millimeter. And it's a little close here if we were doing Emax, but we have plenty of room here for anterior BruxZir. So we can see that what the dentist wanted to do, basically replicate what's here with some minor changes, can be accomplished because of how much reduction there was. And so that's one of the first things we do is kind of compare the two and make sure we can do it. So then the software proposes 4 crowns for this. And for example, the proposal are these 4 crowns right here, but we know that the dentist doesn't want these 4 crowns like this. He wants us to follow the study model with a couple changes, and that's where we can start to make some modifications. So we can either make exactly what you saw here, if you want to just absolutely duplicate that because the patient was happy with it, or the software will make a proposal and then we can make some changes to it. And that's essentially what was done right here, and that's what this cross section is that you're looking at. And so this black line is still the preparation. You'll remember that prep outline from the first time. This yellow line, this golden line right here, is the dye spacer. So this is 50 microns of dye spacer with a little extra here. Just sometimes if we have a sharp edge here, we have to leave just a little extra space here for when it gets milled. So this is our virtual dye spacer all along here. And so that's our 50 microns. This black line represents the minimum material thickness for anterior BruxZir, which is beyond the dye spacer, of course. And so if we wanted to have a crown, this is the minimum material thickness right along here. And so if, in fact, this was what the proposal was, we could pull it off, but we're not doing that. This is the study model line, this black line that comes around here like this. So that actually represents what's on these teeth. And as the doctor indicated to us, he wanted it to be less bulky on the facial and about 0.5 millimeter longer. And so we've taken this proposal and changed it to kind of fit his criteria. So the study model of the crowns that are already on there is this black line, and we've changed it to this yellow line so they're not as bulky. We can see it comes back towards the lingual in the incisal third to give us that flat facial profile. And then the incisal edge is about 0.5 millimeter longer than the incisal edge on the study model, and then it comes back and comes down to the lingual margin over on the side. And so this really allows us to be able to dial in the shape and size of these teeth. We can always take a screenshot of this and send it to the dentist and say, is this what you're looking for? If the dentist has a pre-op study model of either temporaries or the patient's natural teeth and wants to replicate that exactly, these 2 lines would be right on top of each other. So the design would be right on top of what the impression that the doctor sent in of the study models or the temps or the patient's original teeth, because we were going to duplicate that exactly. Or if the dentist wants to make it a little longer and a little flatter, that's why you see this different line. This is the actual crown, actual anterior BruxZir crown that's going to be milled, is this yellow line and then sent back to the dentist. And so rather than just having a technician do it by hand, which is how it always had to be done, and just kind of eyeball it, we're really able to go in here and be able to make specific changes in terms of, hey, let's take this back and make it not so bulky like they asked for and make it a little bit longer. Or maybe you want it bulkier or even longer or shorter or whatever, or follow the model exactly. But with today's CAD/CAM technology, we can literally do whatever you want to do, and we can send you a screenshot for your approval too, to make sure that the crowns you get back are in fact following the prescription that you sent in. So these crowns haven't been fabricated yet. I grabbed this as it was on its way to the mill because I thought it was a pretty fascinating case to show the difference between the two. This is, again, this yellow line is the actual design, and this is the study model. If you take this mask off on the computer, you can see where the actual design underlays this. And so it's really the ability to give you exactly what you're looking for based on what the patient has told you, either according to their original teeth, their natural teeth, or to the temporaries that are in place, or the old crowns they have that always seem bulky and too short to them. This is your opportunity to really communicate with the lab how that I want these flatter and I want these longer, but it can't be done without a study model. This is really kind of the key for anterior cases, is you sending in a study model. The best thing would be make the changes here, take an impression, use Bisacryl to transfer it to the patient's mouth and get their approval. But even a study model like this, if you say, oh, I want these teeth a little longer and a little flatter, that at least gives us somewhere to start. And you and the patient are going to have a much better chance of getting 4 crowns in the anterior that are going to be as nice as you'd both like them to look.
Thank you for that, Dr. D.
You're welcome.
Now let's go to a segment we call Viewer Mail.
I'm actually going to read the viewer mail today, which I usually don't do, but
Wow.
it's kind of a sensitive nature. This is from a dentist who writes to me, and I'm going to keep it very generic and saying, I'm a general dentist. The reason I'm writing to you is because I saw an interview you did with Dr. James Dower in Chairside magazine back in 2010. I've had the unfortunate experience of dealing with nerve damage, mainly pain and burning, from an inferior alveolar block for about a year now. I found out after I had the procedure done by my dentist that the dentist used articaine. I see that Dr. Dower has done a lot of research with the dangers of articaine when used for a mandibular block, and I was wondering if you knew how to get in touch with him since his retirement. I would greatly appreciate any information you can give me on articaine, or if you know an expert. I've been dealing with chronic pain for 1 year now, and it's been the worst experience of my life. It's affected my ability to be a spouse, a parent, a friend, a dentist. I don't know if I will ever get better or how this will all end. And so it's a really sad story, and paresthesias are something that are kind of a reality. Anytime we take a nerve and approximate it to a neurovascular bundle, there can be damage. My cousin we went to dental school together. He had his wisdom teeth out in dental school by one of the instructors, and he had a paresthesia that lasted about 6 months where he was still numb here. And when he would shave, he couldn't feel the razor on that. So it was tingling more than kind of pain and burning like this dentist is having. But what this dentist is bringing up is that it's because of the local anesthetic, this 4% articaine versus the 2% xylocaine that most of us used in school. And I think most schools are still teaching to this date. And what the dentist was referring to in the interview is Dr. Dower actually had me go get the insert out of a box of articaine. And when you get it out of there, I know we really don't usually read these things, but I did read it, and it's talking about the adverse reactions. This is, for the FDA. Adverse reactions in greater than 1% of the patients who received the 4% anesthetic with 1 to 100,000 epi. And out of the 882 people who had an injection, and that's an interesting number, the 882, because I've heard Gordon say once that the average dentist gives somewhere between 2,000 and 2,500 injections per year in any given year. And so roughly probably 800 of those are going to be lower blocks. So this was, 800 people here. So almost the same amount as lower blocks. And when you look at the different things that happen, headache, face edema, pain, one of the side effects in this trial was paresthesia, and there was 11 paresthesias out of those 882 people who received the anesthetic. And so 11 paresthesias is a lot, for 882 people. If you think about maybe that's how many blocks that we give in a year, to see 11 paresthesias. And what he brought up in the interview is that's an amazingly high number of paresthesias, don't you think? And he said, have you ever had one? And I said, not to my knowledge, maybe something transient over a weekend or something, but to see 11 of them associated with the articaine was one of the things that got Dr. Dower interested in researching this. And the opinions seem split. I remember Gordon Christensen saying that In Europe, in Canada, that articaine has basically replaced lidocaine, and so now it's being used for pretty much everything there, including all the blocks. Whereas here in the States, it does seem a little more controversial depending on who you talk to, whether or not it's going to be a regular 2% xylocaine or a 4% anesthetic like articaine that's going to be used for lower blocks. I've always been gun shy about it, and so I've used articaine for all my infiltrations and still use lidocaine for all my blocks. And just because to me, just the mere possibility of somebody suggesting that was enough to kind of scare me away. Even though they say, well, articaine, you know, they're numb faster, it's more profound. You know, I use that wand STA device, and I give 3 carpules of 2% xylocaine with only 1 puncture. You know, you change the carpule over at on the top of the device, and so I puncture once with the needle, and I can dump 3 carpules of 2% regular lidocaine 1 to 100 into that area without having to come back out and re-inject. And so for me, I get profound enough anesthesia and rarely miss a block. It's not because I'm good at it, it's because I'm giving 3 carpules there and don't have to use the articaine. So I wanted to read this letter from this general dentist because I don't know of any other general dentist, no one's ever said anything to me, currently suffering from this type of paresthesia and or nerve damage. I just want to see what you guys, the viewers, had to say about this, where you fall on this, whether or not you're using it, whether or not you know patients who may or may not have had paresthesia related to articaine as opposed to anything else. And I feel for this dentist, and I know that this dentist would like to see patients not have to go through this as well. And so I just wanted to see kind of an informal survey from you guys, the viewers, as to what you're doing and how you feel, because this is something that if it can be avoided, should be avoided. This is a really difficult burden to put on somebody, and it's particularly poignant to hear it, you know, from a dentist who can really tell you what they're feeling and what they're experiencing, and you know, it's just a different viewpoint that you typically get from a patient.
Right, and I know that I've mentioned this before, but anytime anyone wants to write in and talk to us, talk to you, they can do so at mail@chairsidelive.com.
Okay, thank you. I always forget to mention the address, just assuming people will find it. So mail@chairsidelive.com.
Correct.
All right, thank you. So thank you for letting me do that. You have any news?
I do. A family visiting a safari park in South Africa learned a lesson about locking their door when a lioness decided she wanted to ride shotgun. The camera was rolling when one of the cats came up and gave them quite the scare. Let's check out the now viral video.
Holy cow.
Normal. This reminds me of Lion Country Safari, which we used to have here in Irvine, where you would drive through and this kind of stuff would happen. You would see it. Oh, what a sweet little kid. Oh my gosh. Wow.
Opens the door with its teeth.
Oh gosh, I didn't know they could do that.
With the teeth.
Yep.
Well, I feel like anytime we're kind of messing with nature a little bit, like this, driving through a preserve, and something like that happens, we kind of get what's coming to us.
Right. Yeah, it's interesting. One time, when Brandon and I first started dating, we were on a mission to Kenya, working with orphans, and at the end of it, we went on the safari, and we're in the middle of the country, you know, there at the safari park. We're on this special bus, and where you can get out the top of it, and Brandon, we're stopped, and everyone's watching the lions, and then all of a sudden, Brandon just swings his leg over the side of the van, and one of the lions like crouches,
right,
and I screamed bloody murder. I'm gonna get your leg back in here. And he was like, what?
It's
What's
like in the
matter?
cartoons. If you could see through the lion's eyes, it would look like the chicken leg. You
Exactly.
know, in the cartoons, the guy always starts to imagine.
It's crazy. And so that was frightening enough, but to have it open the car door, I would have.
Well, and it seems weird that the lion would look at it. It's not like the lion's looking at it going, oh, that's how you get into the car.
Right.
I feel like these guys were not paying attention, and whoever was sitting in that seat had probably just had like a turkey sandwich and grabbed the door handle. There's probably meat and juice like all over it, and that's the tiger's like, and just tried to bite it.
Right.
But,
he wasn't trying to really get in there, but.
Right. Video arguably would have been more exciting had Lion dragged one of the passengers out. Not that any harm would have come to it, but that would have been super viral. But anything else?
Yes. A powerful slap shot in ice hockey can surely knock some teeth out. but could it remove someone's wisdom teeth? A new viral video features a girl claiming Predators defenseman Shea Weber took out her wisdom teeth with a slap shot. Well, let's see what this is all about.
Shea Weber, he was at the dentist, and like he sent these minions.
Oh God.
Little yellow
Minions.
things, and they did my teeth for me.
Oh.
Bless your heart.
I
And Shea
hate
Weber,
videos like this.
He knocked my teeth out with this slap shot, and it like went across the room, caught it in his hand.
All right, I'm
Okay.
going to stop this because,
Yeah.
first of all, Shea Weber does have a terrifying slap shot.
It is.
will
I
give
think
them that.
I think it's like 187 miles
Right.
per hour.
No, closer to 107, but that's okay.
No.
I watched the NHL All-Star skills contest this year. I hate to pull rank. No, you're right. It was probably like 187 miles an hour.
That's what it said.
I know, but they might have misquoted it too. But the point being, I don't like videos.
Rude.
It started with David to the Dentist,
I know.
where parents started filming their kids in altered states,
Right.
and then putting it online. I guess because they thought it was funny. But if you think it's funny, leave it on your phone, like my cat videos. You know, my cat.
He's got
and-
lots of them
and
too, by the
force
way.
people, your friends and family, to watch it on the phone. This seems to me like a cash grab, like they want it to go viral and they get some advertising dollars from YouTube. And what are you going to do, parents? You're going to follow your kids to college when they start getting drunk and, you know, go around and make
Check
videos of
this
them
out.
doing goofy stuff when they're altered in college as well. Stop it. Leave your kids alone. I feel like the kids are going to get into enough trouble with cameras and iPhones and video cameras on their own. I don't think we need parents setting a bad example like this.
Yeah, and here's my question. Okay, so once the David goes to the dentist video went viral and we started seeing more and more of these things, it started to make me think, okay, are people like cashing in on this in the sense that, like, do you think it's always real or are they totally faking it?
That's a good question. I mean, I guess there's really no way to know.
But I'm saying, I guess I should rephrase that. Are the medicines that are given, are they capable of like producing this result where
and
you're
my oldest daughter made a video of my middle daughter on the way back from having her wisdom teeth out where she had IV Versed, and she was teasing her with this In-N-Out chocolate shake that they had gotten her and with the food.
Yeah.
I was teasing her, and she had my middle daughter in tears as though she was teasing a 2-year-old. And I said, there's no way. Now, she didn't put it online.
Right.
She just never showed it to anybody.
Sure.
Well, she showed it to friends and family.
Right.
And even the middle daughter now thinks it's funny, but she would never, put it online. I certainly wouldn't let her. But absolutely, I saw my 18-year-old daughter crying like a 2-year-old because the other daughter was teasing her with a chocolate shake. So
I could cry if someone was teasing me with a chocolate shake from In-N-Out.
Well, now you can't have dairy,
know.
so yeah, that's particularly poignant. But
Yes.
absolutely, it'll take you back. Your reptile brain kicks in, and all your higher thinking is just out the window. It's like seeing a friend, super drunk at a college party where it looks like his IQ has dropped about 140 points. Same thing, and it's sad. Don't post those videos. That's what your enemies do, not your friends, and certainly not your parents.
Yes.
Well, that about wraps it up for this edition of Chairside Live. On behalf of myself, Megan, the whole CSL crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time. Thank you for what happened?
It took 127 seconds, but I had to cut my arm off.
It's so painful. Should we go to viewer mail now?
I had a hangnail at the break, and I was just trying to get rid of it, and it got out of control.
Okay. The camera was rolling when one of the cats came up and gave him quite the square. Let's check out.
Square, you said.
I did not.
Yeah, he said square.
Why didn't anybody stop me? And the guy's always singing dodecahedron, dodecahedron. I'm like, can't you not walk without your pinky toe?
Right.
We're on this special bus.
Oh, was the story over?
Yeah, sorry, I just went to sleep for a second.
But if you think it's funny, leave it on your phone, like my cat videos.